Doctora Emma Vélez. Yo soy Lady Joana Espinosa Catán. Acudo a usted porque necesito que usted me ayude. Estuve en el PS desde el 29 hasta el día de ayer hospitalizada, esperando una remisión. Me la hicieron anoche y que hoy venía el cirujano y el ginecólogo a venir a las 3 de la tarde, que venía el cirujano y no llegó. Hacen sino hacerme exámenes y no me ponen cuidado. Tengo el estómago muy inflamado, mucho dolor y la verdad tengo 2 niños a los cuales no quiero dejar solos. Yo le pido por favor que me colabore. Muchas gracias.
First of all, it's necessary to understand the origin of medical negligence. So everything government has a role in it. Administrative problems are the most significant factors of the medical negligence. Why? In the Law 100 of 1993, the health system weighted the offer to public and private workers. The offer was weighted, but the demand came bigger. The administrative field of health system cannot operate in these conditions when economic resources cannot solve the crisis in all the country. But we are no one to talk about this. And for this reason, someone in the health field can answer this.
Hi everybody. One of the big problems in Colombia is medical crisis. Health system in Colombia is governed by Law 100 and in the year 1993.
That was good because it improved the coverage and access to health system.
But at present, many EPS don't have resources, medicinals, and their employees haven't been paid.
Why is this happening? Well, there are many reasons. One of them is government installs the EPS money through a process. The real process must be like this.
First of all, people pay for their health. Then the money goes to the government, and immediately government receives the money, they must give the money to EPS.
And unfortunately, in real life, the process is different. The process is...
First of all, people pay for their health. Government receives the money, and they don't give the money. They just stall it, and 3 or 4 months later, they give the money.
For that reason, many EPS have debts and their own risks. Likewise, when EPS receive their money, they must pay their salaries, their public services, and other expenses. So they cannot pay a lot for medicines and for some resources, for example, crutches and wheelchairs and orthopedic color. Yes, so all the problem in health system of Colombia are hospital in rural zone. People who live in rural zone are affected because in that place there aren't hospital with specialist doctors. Just there is an urgency hospital with general doctors. So a person needs to travel around 3 or 4 hours to any city to receive an attention to any specialist. That's worrying because can you imagine a person who has cancer and that person every day needs to travel around 3 or 4 hours just to receive a treatment? That's horrible. Okay, anyway, I think the last problem is prescribed medicine. There are people which have serious illness, and some general doctors always prescribe the same medicine, as you know, acetaminophen, ibuprofen, and sometimes loratadine. So this, as a consequence, brings, in worst case, dead people. Yes, that's horrible as well. Okay, we continue with Manolo. Thanks a lot.
What is the medical negligence? It is the lack of care or application to the protocols and methods previously established by the health authorities and the scientific community. Now we have the steps for appear a claim. The first step is appear a claim to the hospital, because when you are sure that there has been a medical negligence, he directs a writing to the hospital and the doctor who committed it.
Now we have some steps to appear a claim. At first, we have asked for a legal consultation, hearing the right professional, agreeing professional fees, celebrate professional service contract with the lawyer, empowering the lawyer, indicate the facts, agreeing in details direct to the attorney, provides medical recourse for evaluation of a professional, realizes psychological and psychiatric assessment in the event of moral damages exist, estimate the damages including consequential damages and lost product fees, determining the money foregone in the event of having a business or cessation of an activity or employment as a result of bodily injury or psychological effects. The assessment must be performed by a certified public accountant, for which the injured party must be provided documents showing income, type of activity. Submit the application for conciliation direct to a mediation center, paying the fees of the conciliator. Pay fees fixed by the center with conciliation. Celebration of the settlement hearing, discussion and appreciation among lawyers of the parties to the possibles of reaching a settlement. If there is an intention to reach a settlement, it can suspend to hearing for discussion of economic issues. In the event of reaching a final settlement, should celebrate the conciliation settlement in which records the facts, the commitment established, the date of payment, legal or natural person obligated to pay, the person to whom he will pay the payment, and the payment date. The conciliation must contain the elements of a collection executive title. It must be clear, explicit, and enforceable. The conciliation thus res judicata, which means that in the event of default may be charged executor.
What do you think about the nowadays health system?
So, according to the first question, the nowadays state of the health system, we can say that is bad, wrong, broken. At national level, the health system is run in the three sectors: users, workers, and the government administrators. People that is paying the damage are the users, some workers, but primary user. There are situations for lack of resources, lack of economical orders, and capital economic, and sometimes private hospital that the payments or the economicals are in standby, start to close in services, national situation, as in public and private sector is bad. Some towns don't have medical assistance. Workers of the health sector, health field, the remuneration of those workers super low. There are multiple variables. The health system is in crisis, and all the factors that are playing a role. They are not paying attention to the crisis, and the crisis is going to explode, and every day is worse.
What is the reason of medical negligence?
Medical negligence. So we're talking about the ubication of the problem is usually in the worker of health and the doctor when the system is inoperative. A professional can authorize medicine, and the user can interpret that with medical negligence. They say the doctor don't want to do anything, don't want to give me anything. That's why the definition of that is not apparent. The idea of a doctor is always help people because that's why they started that. They're professional for that.
Have you been in this situation?
Personally, no. My relatives or friends or in a liberal way, no. They have never happened to me.